Okay, so Levi and Lee here are going to introduce the beginning of the meeting, the first plenary for the day, and I'll hand over to them.
Thank you, Tony. Good morning and welcome to day 2 of ASIC Ghana. It's so great to be back in Accra and see so many familiar faces from the Ghanaian air quality community as well as the international air quality community at large. I first came to Ghana about 5 years ago, back in 2018, to support the Ghana EPA in installing their first real-time air quality sensor network. And it's so great to see that network continue to persist and stay strong over the past 5 years, all thanks to the tremendous efforts from Ghana EPA, the US EPA, the Columbia University, University of York, and most recently, the team behind Breathe Accra. So thank you once again for having me back. And then my colleague Lee will introduce the plenary.
So Clarity has been involved in many countries across Africa. We currently have active sensors in South Africa, Senegal, Nigeria, and of course, Ghana. So the keynote presentation will be moderated by Miss Sietske van der Ploeg. I hope I said that right. She is the Clean Air Fund's Chief Impact Officer. She oversees how evidence can drive decisions, practice, and impact to create a future where everyone breathes clean air. She has over 20 years' experience in strategy, thought leadership, and program management across the international development and UK voluntary sector, and holds a degree in international relations.
Good morning, everyone. Very good to see you all. And very excited about the next session that is coming up. We've got 2 speakers this morning. We've got one person on the screen who's dialing in virtually, and then we've got one person who will be joining us here today. So the title of the session is Why Should We Care What the Data Says? Now, we've got 2 speakers, as I said, and I think we are going to start with Dr. Gabriel Okello from the African Center for Clean Air, if he is going to be ready now. I don't know if we can check that. In the meantime, just a brief intro on Dr. Gabriel Okello. We saw him yesterday. He's connected to the University of Cambridge and the African Center for Clean Air. And he's the Prince of Wales Global Sustainability Fellow at the Cambridge Institute for Sustainable Leadership, where he leads the research on air quality and non-communicable diseases. Gabriel's current research interests focus on the interconnectivity between environmental health and disease with a view to helping foster healthier and safer communities. Gabriel has a wider ambition to raise public awareness of air pollution exposure and engage stakeholders across African cities to address the air pollution problem by using evidence-informed policies and programs. Gabriel, finally, is also interested in increasing capacity and integrating air pollution data in healthcare, policy and practice, and increasing air pollution, climate change, and health awareness. If he is here, can we give him a hand?
Hello, everyone. Good morning, all those who are enjoying the warm weather, I suspect, in Ghana. And for those of us who are joining virtually from wherever your locations, how are you doing? I've been already introduced. I won't go much into that. Just under note, I'm affiliated with Cambridge as a Prince of Wales Fellow, and I'm also affiliated with the African Center for Clean Air, and a visiting research fellow at Makerere Airco. And today's presentation is basically trying to provide a spotlight, trying to highlight the cost of air pollution due to the different adversities it causes. And as I was introduced, yes, you guessed right, I'm not an economist, I'm an exposure scientist with the interests that were clearly introduced, trying to explore how effects of air pollution on health and environment, trying to integrate this evidence into policy, into interventions, and into practice, and generally also increasing the air pollution awareness. And the approach I really like taking since the recent past 5 years in my journey, in my 8-9-year journey in air quality, is the interdisciplinary, transdisciplinary approach, where we work collaboratively with partners both within academia but also outside academia to try and conceptualize and co-design those interventions that suit various contexts. As you will agree with me that air pollution, because of the different geographic areas we live in, it's heterogeneous in terms of the sources that are causing it, but there are also commonalities. So when we come together and try to foster these interventions, it's really, really important to work with the various actors. And for today's presentation, it's basically looking at the cost of air pollution. And my belief is, I think once we start putting the dollar sign behind the cost of air pollution, once we start putting the Ghana cedi sign, the Naira sign, the shilling sign, once we start putting a currency sign on these losses, maybe just maybe people will start taking air pollution more seriously at individual level, at community level, and international level, and at regional levels. And finding the cost, trying to boil down to the cost, to funnel down the cost of air pollution, it's quite complex and multifaceted. And I'll give you a snapshot of the numbers that have been published globally, but also now funneled down to how it could be affecting me and you economically. And I'll go through the health and health-related costs, the environmental cost, agriculture, the cost of cleaning up environment, and other impacts such as reduction in tourism, which leads to reduction in revenue. So I'll start with a snapshot. And these are, this is research done by various academics and various policymakers. The World Bank numbers, showing an 8.1 trillion equivalent of 6.1 GDP loss damages associated with air pollution. Now imagine 8.1 trillion being lost with something that is avoidable. And I'll bring it down to another snapshot of still a World Bank study done in Lagos, where they found that 2.1 billion, representing 2.1% of the Lagos GDP, was associated to illness and premature death due to only ambient air pollution. Please note, this is only ambient air pollution or outdoor air pollution. Indoor air pollution wasn't even included. Then there's a Lancet study, that was led by Fisher, that provided also economic losses related to disease by air pollution, that showed 3.2 billion loss in Ethiopia, 1.63 billion loss in Ghana, and $349 million loss in Rwanda. So those are some of the studies, and there are many. I looked at from Macedonia to the UK to the US, and also in Africa, just to give you a snapshot. But how do we funnel this down? How is air quality related health costs affecting us? So first and foremost, when we fall sick because of air pollution, there are certain direct costs because we have to pay for treatment. I know in some countries there is health insurance, but I don't think the insurance providers are charities. They are businesses, and they will look at the numbers on the back end, and they will start realizing that, oh, maybe X number of people are coming in because of health, respiratory or cardiovascular related diseases, and then maybe the premium on that could go up, or maybe it has already started going up in certain insurance sectors. So I think this really affects our pockets for those countries where there isn't health insurance, we have to treat. I know when I'm in Uganda, sometimes I self-medicate. When I have a flu, I go to the pharmacy and buy medicine, and this is hitting my pocket. This is something, if it's air pollution related, that is an expense I would have avoided when I visit a doctor, and I have to spend to, first of all, the consultancy and then the treatment itself. So these are some of the health costs that we have to start looking at, both at an individual level and at a community level. Then we can also try to take them at the national level to try and address this avoidable challenge called air pollution. Then there is also the effects of premature death, where someone dies prematurely, so meaning we have lost that productivity. That productivity has completely been wiped out, and this is leading to loss of workforce. People who could be alive and their lives have been cut short. If we're looking at the economic aspect, there are some studies I've quoted here that provide some numbers, and this is by the Lancet study. Fisher provided some of these numbers, and I tried to separate them: the ones as a result of premature death, but also the ones as a result of pollution-related diseases. And the numbers are quite staggering, absolutely staggering. When you look at this column here, these numbers are in billions of dollars. When you look at this column here for health-related diseases, they're in millions of dollars. So I don't think I need to emphasize enough. And I'm aware of the fact that I could be talking to mostly people who are on the converted side. But I think really stepping back and looking at these numbers and exploring what might be if we cleaned up the air and saved this money, I think it's a really important thing to reflect. There is also the cost of absenteeism. Once you fall sick, anyone who has had probably a flu or respiratory-related illness and tried to work, would know that you can't operate at 100%. So that is an absolute loss. Then I'll also highlight on the environmental costs due to the greenhouse gases that are leading to global warming and extreme weather events. Those from East Africa will know that a few years ago we had the infestation of the locusts that really caused a lot of damage in East Africa and some parts of Asia. And I read the World Bank report that was showing the losses amounted up to $8.5 billion. That is really, really enormous. And this is not only causing the such events to happen, but it's also affecting the biodiversity and the whole ecosystem. So I think we really need to pay attention to these numbers from whatever sector, whether in research, whether in policy, whether in media, and all societal actors. We need to pay attention to these numbers and really try to galvanize efforts to try and address this challenge: the extreme droughts, the floods. There were floods all over the world, in Europe, in Africa. We have extreme weather events in the US. So these are all costs. And much as we have a highlight of the dollar sign costs, I don't think we've really gotten to the bottom of the actual loss in terms of money. I actually think these figures are underestimated. I'll take us through also a spot of highlight into the agricultural losses, where the smog and the acid rains alter the pH of the soil, and then also affect the crops. So if we get reduced productivity of the crops, that definitely increases the cost of food. And to me, this is scary because the population keeps on increasing, meaning we need more food. We don't actually need less food. And I was astonished when I read a report which was saying that the ground level ozone pollution is expected to reduce the crop yields by 26% by 2030. So this is quite scary. As the population is increasing, as probably the kids who are young are growing older, we'll probably need more portions. And then you read something like there could be a 26% reduction in staple crop yield. That is absolutely scary. I usually, when I'm having conversation with my friends and wherever I go to present, I tell people that air pollution is the pandemic beneath our noses, because and I think the effort at which we should address it should be similar or even more aggressive than we used to address the COVID-19 pandemic, because COVID-19 showed that society can galvanize itself and really take on a challenge and come up with solutions that will see a massive reduction in the impact of the challenge. And for me, this is what should be happening in air pollution. And then we're also talking about cleaning up of the air. That is another cost that is coming up because the air is polluted and we need to clean it. So we need to set up lots of regulations, lots of compliance measures, and follow them up. There's also coming up with control technologies like scrubbers, catalytic converters, etc. All these are coming up because we are polluting the air. One other thing I wanted to kind of chime in there is also reduce tourism. No one will be willing to go to a place that clearly shows that it's very polluted. People are going to tour and relax. You don't want to be catching diseases whilst you're there. And the other effect where because of the acid rains, they lead to deterioration of buildings because of the acid rain. So this is now causing an increased cost of repair of the buildings. To me, those are really, really huge red flags that we really have to put at the back of our minds, but also start thinking on how we can go on the offensive in tackling air pollution. And I got some of these graphs from a Clean Air Fund report that projects the economic impact of implementing some of the measures. And for me, such graphs should be more and more availed out there, given to the journalists and policymakers around society to try and see and have a think and reflect on the numbers that are being tagged to this challenge of air pollution. We have the business as usual approach, and then how much do we save if we try, if we implement, not even try, if we implement these interventions. I and a group of researchers recently brought a comment at Nature Geoscience, which has been accepted. It will be coming out soon, and we will be sharing it. And one of the things we highlighted, this was a spotlight on Africa. One of the things we highlighted is, air pollution is a massive problem on the continent, and thanks to the continuous monitoring, we are seeing more and more evidence showing that the air pollution is really high on the continent. But we need to have some actions, because there isn't a silver bullet. There isn't a one solution fix it all for this challenge. And we came up with some ideas that we think can be implemented or can be addressed to try and tackle this challenge. One of them was continuous air monitoring. The second one was investment in clean energy. There is an opportunity for the existence of hydro, solar, the existence of solar, the sunlight in Africa. I think that is also I'd call a low-hanging fruit that would benefit. We also talked about the improvement of solid waste management. As the population increases, there's increase in generation of waste. So we need to improve in the waste management and also in environmentally friendly technologies. The industries are coming up. I know governments want to create jobs. We want to be employed, an employment for our brothers and sisters, but we should also think about thriving economically and also sustainably, and environmentally friendly technologies help, and also infrastructure improvements, and be it mobility, which is because of the motorized transport, we are now having a lot of air transport related air pollution. So improvement of this infrastructure would really help in trying to tackle the air pollution on the continent. And I would like to close by, just appealing a call to action because of the numbers that we are seeing economically that are associated with air pollution. I think we need to make bolder transformation to address these systemic risks. We've already seen COVID showed us like the weakest part of society determines how strong our society is. We don't want air pollution to start, causing again these systemic issues. We saw those during COVID. We're seeing them now during because the migration, people migrating from one area to another, and the challenges that is bringing. We don't want to add air pollution to that as a factor that is leading to that migration. We need to increase, the partnerships. Researchers are really doing an incredible job in trying to highlight the challenge, but also being part of the solution. But are we communicating this enough? Are we communicating this in the right way? Are we communicating it right to the right people? We need to examine how this is being communicated. We need to share the success stories, because it doesn't help much if there's a success story in Accra and I need to implement it maybe in Nairobi to try and reinvent the wheel. We save costs in trying to adapt interventions that have worked, suit them to the local context, and then save time on trying to reinvent the wheel. And as usual, I usually appeal that it's very, very key to utilize the academic knowledge, mix it with the indigenous knowledge to spark action at strategic level. I thank you very much for listening. Asanteni sana, medase.
Thank you, Gabriel. That was very insightful. Thank you so much. And I hope you can stay on for questions. We'll have one more speaker to go before we go to the questions. So the next distinguished speaker, I should say, is Professor Kofi Amegah from the University of Cape Coast. In terms of Professor Amegah's background, he is an associate professor of environmental and nutritional epidemiology in the Department of Biomedical Sciences at the University of Cape Coast in Ghana. He leads the Breathe Accra project, which seeks to accelerate air quality improvements in the greater Accra metropolitan area in order to protect public health and help inspire greater action on air pollution in other African cities. He also leads the Ghana Urban Air Quality Project, which began in 2019 and anchors the Breathe Accra project. He's a member of the International Society for Environmental Epidemiology and the Nutrition Society UK. He's also a founding member of the Africa Air Network and a collaborator on the Global Burden of Disease Studies. Kofi, over to you.
Thank you. Thank you for the very kind introduction. Good morning to everyone. I'm happy to be here this morning. Let me also thank the organizers for the harness done me to give this keynote address. The session is about why should we care about what the data says. So I want to speak on leveraging low-cost sensor data to bridge air pollution epidemiologic evidence gap in Africa. Next slide, please. I think I'm missing one slide. So air pollution is the biggest environmental health risk of our time. And that slide would have shown all the risk factors and where air pollution places. But importantly, air pollution is worsening in African countries. So this commentary by myself and my colleague Jay Mensah at the University of Ghana, we try to highlight the air pollution problems in Africa and also propose actions which will also lead to gains in the sustainable development goals. Next slide, please. So if you look at this map, then you start to appreciate what the problems are. The air pollution problems are on the continent. So this is PM 2.5, annual average PM 2.5 levels globally. So look at the continent where we find ourselves. We are in red. That means we are in big problem. But I must also indicate that what you are seeing here is coming from satellite data. And then I'll come to that later. Next slide, please. Then this is, again, in Africa and other developing regions of the world, we use biomass fuels for cooking. So for the uninitiated, biomass fuels are wood and charcoal that we use for cooking in our kitchens. And it generates a lot of smoke in the household, something we term household air pollution. So these are populations, proportion of the populations exposed to household air pollution from burning biomass fuels, solid fuels in households. And again, you look at Africa, you look at Asia and all those places, India, Pakistan, you could see where the problems are predominantly. Next slide, please. This is just to highlight the fact that air pollution affects virtually every organ in the body. Cardiovascular diseases, reproductive outcomes, virtually every organ in the body. And the PM 2.5, which is the smallest, smaller than the strand of hair, is the most deadly for health. Next slide, please. So these were estimates that were generated by WHO just to highlight the fact that Africa, nearly 1 million people die every year from air pollution. So we should worry about what the data says. Next slide, please. And this was a report that was generated by OECD. The reason why I bring this here is that just to emphasize the point that air pollution is causing more havoc than sanitation, than more nutrition, than water, than malaria. And this is where the politicians are putting their money. Politicians are investing in unsafe drinking water. They are investing in poor sanitation. They are investing in malaria, HIV, tuberculosis. Why are they not investing in air pollution? When clearly air pollution is killing more people than all these things. We'll come back to that story. Next slide, please. So I bring this here to highlight the fact that this was a recent publication in the Lancet Planetary Health. And this is changes in population-weighted PM 2.5 concentrations that is attributable to mortality rate. So you get to see what is happening across the world. The reason why you are not seeing much in Africa is because of the limited data. And that's the more reason why I highlight this slide, just to show that we are bereft of data and something has to be done about it. Next slide, please. Again, this is a map. This was a study that was published in 2019 by Katutu and his colleagues. And this is a map of air pollution studies that have been published in Africa. You could see that the evidence that is emanating from here is very, very limited. So the deep star is exposure without any health outcomes, whereas this one is exposure with health outcomes. And you realize that there has been very limited epidemiological studies that have been conducted on the continent. And it's important that we bridge that gap. Next slide, please. Same thing here, here emphasis on studies that have been conducted in several regions. But I want to talk about this. You know, the burden of disease that is attributable to ambient air pollution is growing. And yet the estimates, the impact in the region has been underestimated. The burden of diseases uses something we call exposure response functions. And these exposure response functions generate largely from European and North American estimate, because that's where the cohort studies are being conducted. I'm not aware of any cohort study on air pollution except the graph study which focused on household air pollution by Darby and his colleagues. So the problem here is that the reason why this burden of diseases are underestimated is that there is lack of monitoring capacity on the continent. Accra, for example, has 2 reference grade monitors by EPA. If you add the TIOMs that we have deployed, then we have 6. If you look at the population and the land size of Accra, that's too small. You move outside Accra, there's nothing you can find there. You know, there's also limited epidemiological studies, like I indicated. Hardly are there any cohort studies on air pollution, ambient air pollution on the continent. So how are we going to get estimates to influence these exposure response to add up to the development of the exposure response functions that is used in estimating the burden of disease attributable to air pollution? There are also important population vulnerabilities in the region, and that will also have to be taken into consideration. Next slide, please. So that is what informed the writing of this commentary. Sitting in my office one day in Cape Coast, and I said, listen, there is a boom in low-cost census. How can we not leverage these low-cost census to bridge that epidemiological gap? So I wrote this commentary and I published. It was well received. And in fact, it has also informed some of the things that I've been doing recently in terms of deploying low-cost census across the length and breadth of metropolitan areas in Ghana, and using that for epidemiological research. Some of them I will show very shortly. Next slide, please. So why should we leverage low-cost sensor technologies? Exposure response functions used to estimate GBDs, like I indicated earlier, and just to reiterate a point, emanate from estimate from Europe and North America. And it's important that we have some estimate from Africa. The reasons are extreme population differences, extreme high levels of air pollution observed in Africa compared to the low levels of air pollution that are observed in Europe and North America. There are differences in air pollution sources. Here we have a very toxic cocktail of air pollution sources, of air pollution mixtures here, compared to what you see in Europe and North America. And also importantly, as Apte and his colleagues indicated, the inhaled intake fraction of air pollutant among sub-Saharan African population is higher compared to North Africa, North America, Europe, and Western Asia. And that is the more reason why I think we can leverage low-cost sensors to bridge that epidemiologic research gap. Next slide, please. So just to reiterate the point, how reliable are the GBD estimate for sub-Saharan Africa? If you look at this graph, this was a paper that was published by Hept, Neil, and his colleague in Nature, 2018. So this is what they estimated. The blue curve is what they estimated. And then the red curve is what the GBD studies estimated. So you realize that their estimation, and this was based on respiratory infection-specific mortality among children. So you realize that from what they estimated, the risk is much elevated compared to what the GBD is estimated. And this GBD1 is using IAR functions from Europe and North America, and also leveraging satellite data. So the relative contribution of specific sources of AP differs from what is North America. So I indicate here that the integrated exposure response functions are not applicable to sub-Saharan African settings because we have limited estimates that are going into the development of that functions. Next slide, please. So these are some of the strengths of the low-cost sensor technology. Measurement at a very high spatio-temporal resolutions, and enables us to accurately estimate exposure. And this is the bane of air pollution epidemiologic research, because we are using reference monitors, which covers a very wide scale. You are not able to estimate the exposures accurately. And that leads to something we call exposure misclassification. They also have the potential to advance exposure science, and it can complement the regulatory monitoring and enable us to better characterize air pollution exposures. Next slide, please. So the question here is that why are we not leveraging satellite data? They are brilliant. They offer a very wide spatial coverage that cannot be matched by any ground monitoring technique. And in fact, if we have this, then it's very good for exposure assessment, because we can have estimate exposure at a very fine spatiotemporal scale. But then they have their shortcomings. Satellite-based PM 2.5 estimates are subject to measurement error. The ground level PM concentrations are a better representation of the breathing zone measurement, whereas the raw aerosol optical depth represent integration of the whole atmospheric column. I'm sure the atmospheric scientists here will be able to tell us. I'm not one, and I'm not claiming to be one. The AOD does not represent PM speciation nor the size distribution, and these are two important characteristics for PM toxicity. Next slide, please. Also, ground level PM concentrations are monitored on a continuous scale, whereas the AODs are retrieved only when the satellite passes overhead, typically once per day. And hence, we will not be able to represent the diurnal variability at locations. The satellite data are available on clear days with cloudiness masking the retrieval abilities. That means there's going to be a lot of missing data as a result of cloudiness. Next slide, please. So these challenges, data gaps, led to the establishment of the Ghana Urban Air Quality Project. And the goal was to deploy a mixture of low-cost sensors interspersed with reference grade monitors in the urban landscape of Ghana. We started from our packet. We had donations of sensors from individuals like Dabi. Dabi gave us about 20 purple air sensors, which we deployed in the landscape of Ghana. And then we have moved on gradually, and we've been funded, and now we are deploying more sensors. So with the generous funding from Clean Air Fund, we managed to establish this Breathe Accra project, and the Ghana Urban Air Quality Project anchors the Breathe Accra project. But critical to the success of what we are doing and is close collaboration with the regulatory agencies. We have very close collaboration with Ghana EPA. We have close collaboration with Ghana Health Service and also the city authorities. Without them, we can't do this. I mean, in fact, they need the data to inform decisions. So you can't be sitting in Cape Coast and say you are deploying sensors and using the data for whatever. They need to be involved so that they can also use the data for policy decision makings, and then we'll be able to clean the skies in Ghana and Accra. Next slide, please. So what was the context for establishing the Breathe Accra project? So the city authorities have failed to act on the growing air pollution problem in the city. And this is in spite of the fact that EPA has developed an air quality management plan since 2018. I'm sorry to say it has not been implemented very well. It's being run centrally, but if you want to implement this plan very well, it should be implemented at the local levels. That means the assemblies. The reason is simple. There is lack of reliable data on air pollution levels in the city due to the limited monitoring capacity that I have highlighted to you. There is also absence of evidence on air pollution health effects. And indeed, if we want to increase investment in air pollution, if we want to build strong partnerships for air pollution control, then we need this epidemiological data. There's also lack of capacity at the assemblies to implement this AQMP. And one of the goals of this project, the Breathe Accra project, is building capacities. We've run some workshops, we've built capacity in air quality monitoring, and a whole host of things that is helping to address the problem. Next slide, please. I indicated there are only 2 reference grade monitors run by EPA. One is at Allison's lab in University of Ghana. There's another one at Adabraka. But through our project, we have also installed 4 TIOMs. One at Allison's lab, which he showed to you yesterday. And then there's one sitting on the rooftop here, another one about 3 kilometers away, and another one at Adenta. Then there are opportunities in the assemblies. If you go to the district assemblies, they have Department of Fiscal Planning, Development Planning, Environmental Health, Transport as well. So you can leverage these opportunities to address air pollution problems in the cities. And that is what we are we are doing on this project. Next slide, please. I won't go through this in the interest of time. That's the vision. I think yesterday, Kelvin, who is our community engagement officer, presented this. So next slide, so we make progress. So what activities have we undertaken so far? We have deployed over 50 low-cost sensors. We have developed a web application where in real time, you can, as you sit here, you can know the air quality levels. We have trained officers in these assemblies in air quality monitoring, implementation of the AQMP by Ghana EPA. We are also helping them to know the bylaws, know what are the air pollution stuff, the bylaws that can address air pollution directly or indirectly. Next slide, please. What are our planned activities? So this deployment map you saw yesterday. Next slide, please. So this one on my left is the TIOM that is sitting up there. During the break time, if you want to have a look, we can take you up there. This one is also sitting at Sietske, Ghana, Dubai. And then these are some of our low-cost sensors. Next one. These are clarity nodes that we have deployed in spaces of Accra. Next slide. This is our web application. Next slide. So our planned activities. We have recently just hired a policy engagement officer so that he will interface with the assemblies on policy. So basically, we have identified through the data that we are collecting, we've identified some hotspots. Where you are now is one of the air pollution hotspots. Just about 200, 300 meters away, there is the biggest market center, I guess maybe in West Africa, Makola Market, one of the polluted areas, Agbogbloshi, where they do e-waste burning. There's a place we call Choco Tea Gardens. That's where they do all the smoking of the fishes. So we have identified these places. Our policy engagement officer is going to interface with the assembly to develop interventions to bring the air pollution level down. So we'll do an evaluation to be sure. We have the data as well to show those things. We're going to be training environmental health officers in health impact assessment. We have policies. How do we know that the policies are helping? Are helping in terms of health impact. So we're going to be training them in health impact assessment. We also want to train health staff to do surveillance for air pollution related diseases. Next slide. So what studies have we conducted so far that exist so far? Not what we have conducted, but exist globally that have leveraged low-cost sensors for epidemiologic research. There are a number of studies that have done modeling of air pollution using low-cost sensors. But in terms of the health effect studies, in fact, next slide. One by our group, which was conducted among street vendors. And the street vendors, you see them. They are all around. When you go to lunch, you see them carrying their wares all around. It's a group that I've enumerated extensively for my PhD studies, and I continue to look at that group. So here we use, next slide. We have sensors in some areas, and these are the paths that the street vendors traverse to do their vending. So we have sensors there. We use the sensors here to estimate their air pollution level and look at its association with respiratory and cardiovascular outcomes. Yes, next slide. Next one. And then another thing that we do, another thing that we did together with this one from Clean Air Fund was to engage the street vendors. We don't only do the research, get our results published, get promoted, and get out. We brought the street vendors into this very, very room and engage them with the results. And then to also advise them on protective strategies that they can do to mitigate their risk from air pollution. Next slide. The other, together with a good friend, Eric, who was previously at Florida University and now in British Columbia CDC, we leverage the data from ECHO to develop a line use regression model, which is one of the very first for any African country from the low-cost sensors. Next slide. From the ECHO devices. And then their data was also compared with a BAM, I think the US BAM as well. And then it correlates very well. Importantly, we also compared the data from ECHO devices with Clarity. I must say Clarity is the market leader. when it comes to low-cost sensors. And again, we found it to be correlating very well. Yes, next slide. Next slide. Then this is again with Eric, we leverage low-cost sensor data and Ploeg sensor, which was in a region in Brazil, to look at its association data from that with its association with respiratory hospitalization. Next slide. And here what we did was that we look at the corrected data, how that one is associated with the health outcomes, and also how the uncorrelated data is also associated with the health outcome. I think I might have to wrap up, isn't it? Yeah. How many minutes? 3 minutes. Okay, so next slide. Next slide. So next slide, please. So what are some of the ongoing research studies that we are embarking upon, that we are leveraging data from? We are going to leverage data from Breathe Accra project. Next slide. There's a study we are about to start called a RIPE study. And here we are interested in respiratory illnesses among school children. And again, we have sensors in these schools, and we are going to leverage the data from these sensors to estimate air pollution exposure around the schools and its association with respiratory outcomes. Next one. Next slide, please. DMAP. This is a study that is funded by Grand Challenges Canada. And here, dietary interventions to mitigate air pollution health effects. And this study will be starting next month. And here again, the focus is on street vendors, and we are going to be providing some nutritional interventions. One of the things that we recommended to the street vendors that when we brought them to this room is also look to improving their nutrition. So here now, we want to test that intervention to see whether it will be able to mitigate the health risk among street vendors who are exposed to dangerous cocktail of air pollutant. Next one. And here too, we are leveraging the low-cost sensor data. We have just received funding from NIH to implement this study where we are leveraging data science applications to improve children's environmental health in sub-Saharan Africa. And here we are working with our Uganda colleagues where we are leveraging the ECHO data. We are also leveraging our Breathe Accra data, and then combining that with DHS data on child health outcomes to see how the associations will be like to inform these integrated exposure response functions that I talked about. And then the final one here, before I go to the conclusions, next slide, is a study that we are pitching to a funder. And here, we also want to leverage the low-cost sensor data and also try and establish a maternal and child health surveillance system in Accra to couple with the Breathe Accra project. Then again, we'll model air pollution effects on maternal and child health. Conclusion. So the session was about why should we care what the data says? We should care about what the data says, else public health will be in jeopardy, as you can see. And low-cost sensor technologies can be leveraged to bridge the huge data gaps in sub-Saharan Africa. However, the note of caution is that the most promising sensors should be embraced to assure quality, data quality, and inspire greater confidence in the decisions that will be reached with the data gathered. Thank you for your attention.
Thank you. That was incredible. Thank you very much. Both speakers, actually. Maybe we can get Gabriel back on the screen. How much time have we got for questions? 10 minutes? Excellent. Let me walk around with the microphone. Are there any questions for either Gabriel? We can get them on the screen, or or Kofi. Let's take a couple of questions.
This is mostly for Kofi, but maybe Gabriel has some thoughts. So correct me if I'm wrong, but Ghana EPA still makes accessing their air quality data very difficult, right? But you guys have made yours open, and you're in talks with communities and assemblies and things about using it. Have you pushed this back towards like Ghana EPA and have tried to convince them of the efficacy and importance of open data?
Could you hold on for 1 second before you answer? Or just take one more question if there's another question.
Great. Again, this question is mostly for Kofi, but I couldn't agree more about the need for big cohort studies in Africa. But I'm curious to hear your take on the health data availability. I mean, that seems like increasingly it's the binding constraint, and I'd like to hear your thoughts on what the state of access to large scale administrative health data is to input into those kinds of studies.
Thank you. Can we get Gabriel back on the screen? Is that possible? Kofi, do you want to start?
Ghana EPA and access to data. I have to be careful here. In fact, I mean, let me admit that the Ghana EPA had challenges, you know. So initially, some years back, they had a model whereby if you want access to the data, especially for health research, you have to pay something. And that was to go into resourcing their department to be able to continuously generating the data. I don't think it was a bad idea. But I think increasingly WHO, World Bank made them aware that, listen, if you want us to continue funding you and supporting your program, you have to make the data open access. There has been a lot of changes. Importantly, there is a lot of citizens now in the space that are also generating data from low-cost census, but some of these data have been corrected, things that were published by Garima and his colleagues done as well. So now they understand. They are also using some clarity census. They have issues now with the census. Now we have moved to the level whereby they have a Twitter handle where on a daily basis they are producing real-time pollution levels, which is good, which is brilliant. We work closely with them. We let them understand that what we are doing is a public good. The data is for everybody. So that's what we do. They have bought into our model. We understand them. We have collaborations with them. They come to all our workshops and everything that we do. So yeah, I don't know. I'm sure I've answered your question. Yeah.
Gabriel, did you want to add anything to this point before we move to the second question?
Well, I can't speak for the Ghana EPA. Probably I can speak for the situation in Uganda, where I've been working with AirCo, and I think for AirCo it's a bit different. That from the word go, they made their data open and accessible to basically everyone. So it's a bit different. I haven't experienced finding difficulty to access data from Uganda.
Thank you. Would you mind picking this?
I think there's a reaction to my comment. So let that reaction come and then we can take it up to.
So coming from Ghana EPA, and I wanted to correct the fact that we have never taken money from anyone in Ghana to provide data. So that is wrong. That is a falsehood. Because I myself used to be in charge of environmental quality for many years. And normally I will be the one to give the data. We have never. The reason why maybe in the past it was difficult to give out the data, we had used a lot of passive monitors. So you are using high volume samplers, minival samplers, dragger tubes. You get the information after the episode has passed, because you put it on a filter, you have a high volume sampler, which you put a filter on it. You have to come back and analyze the filter. Now that we have reference grade equipment, we are providing that information to the public. So I think it will be a bit out of place to say that in the past, and we have always availed ourselves with all our stakeholders to provide our data to them. We use the data to create awareness to the public as well. We use it for policy formulation, for interventions, which has led to the standards, the regulations we are working on. Industry are required to submit data. That data is also used for policy formulation to educate the public. And so now that we have sensors that can give you real-time data, it is a bit easier to give that data real time. What we are doing, even with what we do, is because we can't wait till the end of the day. So we take it from 12 midnight to 10 a.m. From 6 to 10 a.m. in Accra, for example, is the peak period where the air quality, the particulate load is high. So around 10, we give the data because that would then inform for the whole day. And so if we've always had real-time monitors, we would have provided the data on real time. Now that we are doing that. 2, we have never taken money from anyone. Doc, I don't think you've come to EP and we've actually taken money.
I have I haven't paid for any data from EPA, but I mean, in fact, the information that I'm putting out there is information that masses around know. So maybe it's ill-informed. And then I'm glad you are here to react to that. Yeah.
Thank you.
The other one has got to do with Darby's question in terms of access to health data. Yes, the health data are there, but in fact, they are poorly documented. We are still doing manual collection of health data. They are not digitized, So there are some of the studies, for example, that we want to undertake. You have to visit the health facilities to do manual collection of these things. And you realize that most of the registers have missing data. So we need to move to a level whereby we are going to digitize all our reporting system so that we can have very proper health data to be able to complement with the air pollution data that is being generated in the spaces. But we need to get cohort studies, to strengthen the epidemiological evidence.
Thank you. Gabriel, did you want to come in on this?
Yes, absolutely. So I think the point about the health data is quite important, and I would like to add on to what Kofi just mentioned. I myself have been undertaking a study together with the Makerere Lung Health Institute and Makerere University Airco in assessing the association between ambient air pollution and respiratory health, and get the health data for Uganda through the Ministry of Health. We managed to access respiratory health data from the District Health Information Software. It's the DHIS2, which they are using, but it also has some challenges. You find in some years it was I think being collected manual and then updated on the software at the end of the month. So you have monthly averages. Now try writing a paper with that, with monthly averages of health data, correlating it with air quality, and then you'll get an absolute hammering from the reviewers. But I think for me, the positive that has come out of it is that we've been able to engage with the Ministry of Health and some health centers, and to try and explain to them what the kind of data we would want. And we're not under any illusion that this is going to happen overnight, but at least there is conversation of the kind of data we want, even if it's like daily averages, that could be very, very helpful. And we are continuing with this engagement. We're now getting off another study, which is going to be looking at how do we integrate air pollution information into disease management within healthcare facilities. So the health data is there. The only thing is, how you get it, and also the quality of the. I want to use the word quality of the data in a conscious way, because I'm in no way blaming the health practitioners, because I know that the patient to healthcare worker ratio, especially in the African countries, is so huge. But as we improve the quality of the health data, I think we will be getting to that direction where we can easily compare health data plus air quality data. And the other option, of course, is to do the personal monitoring, which is also quite an expensive undertaking. But I think, the health data is there. The only thing is the challenges around it. Of course, getting it is quite challenging because of confidentiality purposes, etc. But it's there. The only thing is, what quality of the data is there? You know, the Kofi mentioned about missing data. So those are some of the things we have to contend with.
Thank you, Gabriel. I hope that answered the question. I'm going to have to round us up. I've been informed the coffee is here, I think. A big hand for our speakers, or maybe the coffee's not here. I don't know.
Good guess. But it is arriving, I'm told. So anyway, we have a couple of quick things here. So first, I'd like to introduce Isi Naketete, who is Deputy Executive Director at the Ghana EPA, and she would like to say a few words to us this morning. Thank you.
Good morning to all of you. I'm here to do this welcome on behalf of the Executive Director of the Environmental Protection Agency, who would have loved to be here himself, but has been asked to attend to an equally important assignment. Before I go on, let me say that at EPA, we are ready to work with all the stakeholders. Dr. Amegah is one of our stakeholders. We believe that monitoring is key because there's a saying that you only know when you measure. So when you know what the levels, air pollution levels are, then you can do something about it. I myself have been very passionate about air pollution issues because I've been in the industry working with the EPA on these issues for quite a while. And we started in 2003 with the support of the US EPA. We were able to set up a network of monitoring stations, which maybe were more of passive monitors because they were not real time. But the good thing about those equipment is you are able to use it for a very long time. And so we've deployed some for about 10 years, and we are still using them. So we are committed to working with all the stakeholders to ensure that we safeguard the life of our population, because it's very key. I mean, that's why we do public work, and we are there to ensure that we protect and safeguard their lives. And so, Mr. Amegah, Clean Air Fund, and all the other stakeholders, we want to let you know, as we've done in the past, that we'll continue to work together with you to ensure that the environment is protected. And so I have a prepared speech here. I know that this is being organized by UC Davis Air Quality Research Center. So the reps from the UC Davis Air Quality Research Center, Clean Air Fund, IQ Air, and Clarity, I believe, are the sponsors of this program. The committee members who have put together this excellent program, resource persons, participants, ladies and gentlemen. I want to warmly welcome you to this conference. And I wish to, first of all, thank the organizers of the conference for choosing Accra, Ghana for this all-important conference. Air pollution has become a concern. As I mentioned earlier, I personally am concerned, and I believe that it's a concern for both the international community, regulatory agencies, research institutions, among others. These concerns stem from the negative impacts of air pollution on public health and the environment. We have a lot of statistics from the World Health Organization that 99% of the world's population lived in areas where the WHO air quality guidelines were not met in 2019. That's a very difficult thing to take, that 99%. Outdoor air pollution alone was responsible for an estimated 4.2 million premature deaths in 2019. And then the WHO again says the combined effects of ambient air pollution and household air pollution result in 6.7 million premature deaths annually. In Ghana, once again, WHO projected that maybe, or estimated that in the year 2020, 28,000 people died from exposure to air pollution. With the rapid population growth, economic development, and consumption patterns, the current statistics, as I have mentioned, is likely to increase if no action is taken to tackle these drivers of air pollution. And I have mentioned that the institution I work with, we are very committed to ensure that we do that. Also beyond that, there's a need for us to take action because these are also linked to the Sustainable Development Goals, especially Goal 3, 11, 13. Goal 3 seeks to reduce the number of deaths and illnesses from hazardous chemicals, air, water, and soil pollution and contamination. Goal 11 seeks to reduce the adverse per capita environmental impact of cities by paying special attention to air quality and municipal and other waste management, whilst Goal 13 seeks to combat climate change and its impacts. Distinguished ladies and gentlemen, globally, governments, including the government of Ghana, are making efforts to reduce air pollution. I believe we all know that. The only way to assess the effectiveness of the interventions being implemented is to monitor the pollution level. So whatever interventions we put into place, if we don't monitor, we wouldn't know whether the interventions are working or not. So it's very important to look at that. However, the traditional regulatory grade air quality monitoring equipment requires significant investment to install and maintain. This has made it very difficult for most developing economies to deploy air quality monitoring equipment over a wide area to gather hyperlocal and comprehensive pollution data to aid decision making. And this is the example of EP. We have 2 regulatory grade monitors because we were assisted by the World Bank. We've had monitors which we have bought in the past. But if a monitor is to cost us maybe $200,000, $300,000, we might not be able to deploy this equipment all around Ghana because it will virtually drain the institution. It is therefore welcoming that low-cost sensors have been introduced to supplement the traditional regulatory grade monitoring systems, in spite of some divergences in data collection as compared to the traditional regulatory grade equipment. I wish to commend the international research community who have conducted and continue to conduct research into the challenges associated with the use of low-cost sensors and are here in Accra to share their findings. This could potentially help address the challenges and upscale the use of the low-cost sensors to improve the monitoring efforts, especially in Africa. The EPA Ghana, with support from its partners, have added a number of reference grade monitors and low-cost sensors. As Dr. Amegah mentioned, we have acquired about 36 low-cost sensors, and we are planning to deploy more in most of our regions. It is my hope that low-cost sensors that have gone through the approval process will gain wider acceptability to help monitor pollutant levels to identify areas with poor air quality. This information can be used to develop air pollution control interventions to improve air quality for improved health outcomes and ensure a better quality of life for our population. Distinguished participants, the low-cost sensors can complement regulatory traditional air quality monitoring equipment. It is my hope that the African community especially will take advantage of this monitoring system to provide real-time hyperlocal air quality information to educate and sensitize the public on the quality of air, as well as help local authorities to track air pollution and take practical actions to control pollution from area sources such as open burning, commercial cooking, and unpaved, unvegetated surfaces. I once again wish to warmly welcome you to Accra. For those who are here for the first time, I would ask that you take time off to visit different areas in Accra. I wish all of you a fruitful deliberations. Thank you, and God richly bless us all.